in June, he graduated from high school. I mean, the whole setup, everything about it was fantastic, because he was the only the only person at a school of about 1,200 kids who was in a wheelchair. Not only was he able to get up on stage to get his diploma and get off the stage, but all of the kids had to walk up the ramp and down the ramp. And it was amazing. And then one of his teachers made a speech when he got an award. The speech that she made, the way she talked about Jacob and the effect that he had on her and other people in the school was just absolutely incredible. And there must have been about 300 some odd kids graduating, so times 2 or more for all their guests. So there was a room of about, at least 700 people there. And, as she finished that, the entire room stood up to give Jacob a standing ovation. So that's the memory. I mean, and it's a pretty recent memory, because it's about 3 months ago. That's like, wow, he's still doing it. He's still having such an impact on people. My name is Marcy White, and I was born in Montreal, and I moved to Toronto, and I've been here ever since. My story is still being written, and there are so many chapters to it. But I think in a nutshell, it started when, the second Jacob was born on May 15th, 2002. The second he was born, we knew there was something wrong. He had trouble breathing. So that started us down the road that we are still on. Over the course, of the years, we've had, I have, in addition to Jacob, I have twin girls who are 18 and off in university for the first year. So, our life, our home, everything is changing. Jacob has a very rare neurodegenerative disorder that unfortunately only gets worse as he gets older. So when he was younger, he was able to do a lot more. I mean, I say this, but he still always had limitations. He was never able to walk, he was never able to stand, he was never able to talk, and he was never able to eat. With his mouth, he has a tube in his stomach. But he was able to communicate in his way. He was able to have, a little bit of movement in his arms and his legs. And over the course of, the last number of years, he no longer has that ability to move any of his limbs. And his ability to communicate is limited right now to eye blinks for yes. And that's when he feels like it. So it's changed. Our story has changed over the years. It's evolved. But the one thing I think that I can say has stayed the same is Jacob's attitude and his, ability to find something to smile about. The interesting thing is, over the course of Jacob's life, which has been the past 21 years, it's changed. Because when he was first born, there was no such thing as Facebook or, the internet in terms of communicating with each other in the same way that we have now with groups and chat groups. And I remember, when Jacob was first born, and I was trying to even just to research his symptoms. I would plug in, some symptoms to try to find some articles, but I couldn't even access the articles. I had to get my brother-in-law, who was a doctor, to access the articles for me, and he'd come back with paper stacks of paper, and I'd kind of go through them. I'd feet high of all the different articles. So at some point over the years, I think the first thing was Yahoo groups. And so I was able to connect with some other families whose children had Pelizaeus-Merzbacher disease, which is what Jacob has. And that was my first experience with the community groups. But then over the years, as Facebook has evolved, it's been such a huge network for me, and I think for other families like me, to the point that I would say that I learn more from other families than I do from the medical textbooks and the medical, professionals, because it's something about hearing from people who have been there, versus just somebody who studied it as opposed to lived it. So yeah, so the experience and the relationships I have with other families are huge sources of information, of strength, of feedback. And not just other families with kids who have PMD, but all sorts of different challenges. I don't know if I console people, so to speak, but I do speak to people. Gotcha. And I share my experiences. And, looking back, I think there are stages, right? So it's, when Jacob was born as an infant, we didn't know what was wrong, but we knew there was something. That's kind of a whole phase in itself. And then we found a diagnosis. And it's like, okay, we have the diagnosis. Now let's figure out what to do with it. That was another phase. And then, as he's growing, as he's changing, we're learning more things. Yet another phase. And now that he is the age he is and, facing the things he's facing, I look to a different group of people who have been there, been in my shoes, once upon a time. But at the same time, I have the experience to share with other people who are just starting or who are in various different segments of the journey. It's funny, yes. I mean, I would use the word friends for a lot of these people who I've never met in real life, but I've communicated with them. Most of the time it's through Facebook. When he was little and we didn't know what was what and, what was going to be and what was wrong with him and, if there was treatment, we were just looking for infant milestones, and the first one is, a smile. And I think with most kids that happens at around 6 weeks. And we didn't see a smile, and we didn't see, we thought maybe we would, maybe we wouldn't. And then when we did, it was just like, oh my gosh, that was just, it was just such a feeling of, wow. And, it was unlike a lot of other people whose infant smiles are what they are. Jacob's first smile, he had teeth during his first smile, but it was just so amazing. And I think we did everything we could, and still to this day do anything we can to try to get him to smile. He likes jokes, he likes slapstick, but I think he gets the biggest belly laugh if somebody falls or gets hurt or just stubs their toe. And in my mind, and I've actually asked him this too, it's almost as if he is laughing because somebody's saying ow and they're in pain. And he's almost saying, ha ha ha, you think that's pain? So try spending a minute in my body and you'll see what it's like. And so that's how I interpret, when he laughs when somebody gets hurt. That's what I interpreted that as. Sneezes were a thing that made him laugh for the longest time. And so we all go around, sneezing and to this day, my daughters make fun of me when I sneeze because I'm so used to exaggerating a sneeze that I think it's just become my normal sneeze now. When he's communicating, when he's, alert enough to want to communicate with us, and he'll blink his eyes, but it would be, if he really wants to do something, it will be a very, very purposeful blink that he keeps his eyes closed for a second or two and then opens it. So to say, yes, and it's evolved over time. It used to be, he'd have a switch that he can access with his cheek or with his elbow, and it had a whole bunch of different categories in there, and he'd be able to initiate jokes. But as time went on, he lost the ability to do that. So we've adapted and tried to figure out ways that he could, because he's so alert and aware inside that we're just, always trying to find ways for him to be able to express what he wants to express to the best of his ability. He's become more locked in. It's become much more limited. In June, he graduated from high school. I mean, the whole setup, everything about it was fantastic, because he was the only person at a school of about 1,200 kids who was in a wheelchair. Not only was he able to get up on stage to get his diploma and get off the stage, but all of the kids had to walk up the ramp and down the ramp. And it was amazing. And then one of his teachers made a speech when he got an award. The speech that she made, the way she talked about Jacob and the effect that he had on her and other people in the school was just absolutely incredible. And there must have been about 300 some odd kids graduating, so times 2 or more for all their guests. So there was a room of about, at least 700 people there. And, as she finished that, the entire room stood up to give Jacob a standing ovation. So that's the memory. I mean, and it's a pretty recent memory, because it's about 3 months ago. That's like, wow, he's still doing it. He's still having such an impact on people. It's surprising. We weren't expecting it, but it was just. I think probably more people than not had tears in their eyes at that moment. It was incredible. Oh, he's had an impact on people, and he's been doing that his entire life. So my undergrad degree in science and anatomy certainly helped me understand, the early days, what was going on with him, and understand, how his body worked to a degree that I never studied in school. It was obviously much more detailed, but I understood that, and I was comfortable in that environment and with that language. It's funny, and then when people hear that I have, both an MBA and an MSW, they kind of laugh, because they are two very separate things, sure. Very, very different degrees, but I think they for sure helped because, well, first of all, the business part of it, helps, got to run, Team Jacob, which involves a lot. And I guess that the social work part, I think I probably learned much more about being empathetic and understanding from being Jacob's mother than I did in school. Wow. But it's a nice compliment to have. Now I'm back in Jacob's hospital room, and I'm looking at the paint swatches trying to figure out which is the right color for his room, and I really at the time did not care. But a month earlier, before he was born, I remember being in the back of the back part of a store, test driving strollers to see which one felt better. So, it's perspective. It's perspective. At that time, it's like I had to choose the best stroller. I wanted to make sure, the color of the paint is the perfect color for his room. But now, I look at things very, very differently. My perspective has definitely changed. I knew very early on that we needed help, that I wasn't able to do it alone as much as I really wanted to. And especially as his medical needs got more and more severe and intense, we needed more and more help. The problem was, well, there are many problems, but one of the ways that the home care system is set up is that it doesn't usually allow the family much say in who gets sent to be the caregiver. That never sat well with me, and I would voice my concerns and my issues quite strongly, because if there was somebody who came to our house to help care for Jacob, but who clearly did not have the skills necessary, I wouldn't be able to keep that person in my home. And that's been something that has been a very, very, very big challenge ever since the day he came home from the hospital at 3 months old. Setting the standard to make sure that Jacob was safely taken care of. It goes in stages. We've been, very fortunate with one of our nurses who has been with us since Jacob came out of the hospital in 2002. So 21 years she's been with us. But because of the level of care Jacob needs and the amount of care he needs, we need lots of nurses. And it's very, very, very difficult finding nurses who have the skills necessary to safely care for Jacob, the commitment needed to take a regular shift and stick to that shift, and the desire to do it. That's been, I think, put those things together, it's been the hardest, because we need so many hours of nursing. We need so many people. So we have over time, found excellent nurses. But it's been through lots of challenges and lots of trial and error. At this point, I'm, 20 years older, wiser, more experienced. And I don't just, when I talk to an agency, say, okay, can you send me whoever you have? And, I have long discussions with Anne about, the background of the nurses, the experience that they have, and, whether or not she and I feel that this person would be a good fit. I don't really have the luxury of choosing agencies, unfortunately. But what I can say is we've tried to work with lots of agencies over the course of the years. And there have only been a couple of agencies who have stood the test of time and who have, we've stuck with them and they've stuck with us. There are some agencies that were contracted to provide nurses and have not been able to provide a single nurse with the skills we need. There was another agency that provided the nurses, but there were so many errors and so many near misses that when I would speak out about it, instead of them fixing them and changing their practices, they fired us. We've had nurses who have moved from one agency to another agency so that they can continue working with Jacob. So we've seen a lot over the years. There are many cases of nurses surpassing the expectation, and those are the nurses that we love working with that become like family. There was a nurse, a little while ago that was talking about how, she now sees Jacob like a little brother. And another nurse who, like I said, we've known her for 21 years. Other nurses who, when they're on their day off, they still check in with Jacob to see how he's doing. So it's, we strive to create those types of relationships, but it can't be one-sided, and the ones that work are the ones that naturally work. And, years ago, something that I realized is that the person that works best with Jacob is somebody that actually wants to be here. That it's, they're enjoying what they're doing and they want to be here, and it's not just a job that they clock in and clock out. Because those relationships, those peter out over time. But the ones, who have, who are doing this because this is what they want to be doing, those are the ones, that work the best. In terms of working with agencies, the ones that we work the best with are ones that will see Jacob as a person and not simply a shift to be filled. I think what I would say, and I'm not being coaxed to do this or asked to say this, I think a lot of the other agencies could look to Agile and to Anne and learn a lot. I think at the beginning when I first started talking to Anne, she was very friendly and very positive, and told me how much she was had Jacob's best interest at heart. And I don't know if she realized it, but I heard the words, but I'm like, okay, I've heard this before. But it wasn't until time went on and the words became more than words, and the words translated into action, that I saw that what she was saying, she was meaning, and that made a huge difference. I mean, I don't know how many times I've had to say, to tell different people, he is not a shift to be filled. He is not a body in a wheelchair. He is a person, and he deserves to be treated as such. If I was talking to other families, the one thing I would say is pick your battles, because this life, like raising a child with a disability, is not easy, and it's exhausting, and it never ends. And there's lots of things that could be better and should be better. And you'll burn out real quick if you try to right all the wrongs. So it's, choosing what really means something to you, what's really important. And those are the ones that you should spend the most effort trying to get right. Politicians, hospital administrators, people in positions of power, and people who have the ability to make the decisions and affect other people's lives. What I would say to them is listen to the families. They know what they're talking about. They're in the trenches. And this home care system, the way it's set up now, is a mess and needs to be rebuilt. And it needs to be rebuilt with the patient and their needs at the center.